So hello friends, now in this video we are going to discuss the next topic in our Autocoids chapter, okay, and that is our histaminic drugs, okay, histamine basically. So let's start with the histamine, okay. So first we will talk about the synthesis of histamine. So histidine, from histidine by the action of enzyme, that is histidine decarboxylase, histamine get synthesized, okay. So this is the basic synthesis process of the histamine. Now coming to the receptor, that are the very most important part of the this topic, okay. So we will discuss the receptor functions, by which mechanism it is functioning, and what are the effects on our body when these receptors are activated. So we will study four receptors, okay, H1 to H4. There are the four receptors and all are GPCR, mind it, all the four receptors are GPCR. H1 is of GQ type, H2 is of GS type, and H3 is of GI, and H4 also GI, okay. So H3 and H4 both are of GI type, means G inhibitory type, okay, and H1 the most important is your GQ type, clear. So let's move to first, that is H1, okay. So H1, this receptor is present in CNS as well as periphery, okay. In CNS it will act as a neurotransmitter, okay, and it exerts two important effects, that it increases wakefulness, okay, and it suppresses your appetite. You can remember like this: when you write W means W this, so increases wakefulness. When you write A this means it decreases your appetite, okay. So increasing your wakefulness and decreasing your appetite. Now when these receptors are present in periphery, they mediate allergic reactions, okay. They mediate allergic reactions, such as increasing blood vessels permeability, okay, causing vasodilation. This type of effects are mediated in periphery. Now coming to the H2, so the most important location of H2 is in the stomach. When H2 is stimulated, it will increase your HCl production. So in cases of peptic ulcers, we give antihistaminic drugs, that is which blocking H2 receptors, okay, like ranitidine, cimetidine, like these drugs, okay, which block H2 receptors. In this chapter we will confine our discussion to H1, okay, antihistaminic, which are blocking the H1 receptor. In our GI chapter we will discuss about H2 blockers, clear. Now H3 and H4. H4 is present on WBC and it is responsible for chemotaxis, clear, and H3 is presynaptic autoreceptor. So when it will be stimulated, it will decrease the histamine release, so it will decrease the effect of both H1 and H2, because if histamine amount is decreased, then H1 receptor and H2 receptor both functionings are going to decrease, okay. So it will suppress your allergy and acid production, clear. So this is the brief intro about the histaminic functions, its receptor, and what are the effects it will produce in our body. Now coming to the drugs. So H4, there is no drug acting on H4 receptor, okay. H3, so we have got H3 inverse agonist, remember this, because this is very important from a general pharma, okay. They will ask name a drug which is inverse agonist, so you can tell triprolizant, okay. Triprolizant is a drug which is H3 inverse agonist, clear, means it will increase histamine release, okay, and it will cause wakefulness, clear, because inverse agonist, so it is functioning in opposite direction, and this drug is used in treatment of narcolepsy. Remember this. Although drug of choice for narcolepsy is modafinil, that is a sympathomimetic drug. We will discuss in sympathetic part, okay. Now coming to the H2 receptors. So H2 competitive blockers are there to decrease HCl, and it will be used for treatment of peptic ulcer, as I have told. Two drugs you may remember: cimetidine, ranitidine. Many more drugs are there: lafutidine, okay, famotidine, like this. So this is the basic concept regarding the receptors and its functioning. Famotidine, loxatidine, lazatidine, these are the drugs. Now one more important point you may remember: famotidine. This is non-competitive blocker, okay. Rest all are competitive blockers. So this is important from your MCQ point of view. That is which H2 blocker is non-competitive in nature. Just you have to give the answer famotidine. Okay, famotidine is a non-competitive blocker. Now coming to the most important part of this chapter, that is H1 blocker, okay, H1 receptor blocker. So first we will discuss H1 partial agonist, okay, H1 partial agonist. So that drug is beta histidine, okay. This drug is beta histidine. This is a H1 partial agonist and it is used for the treatment of vertigo, clear. So remember this beta-histidine that is used for the treatment of vertigo. Now coming to the second, that is H1 competitive antagonist or H1 blocker, which is also known as antihistaminic. Okay, we usually use the term antihistaminic. So that term is basically referring to H1 blocker, H1 receptor blockers. Okay. Now coming to the drugs. So these drugs are categorized into two groups. That is first generation antihistaminic, and the second group is your second generation antihistaminic. So it has two groups: first generation antihistaminic and your second generation antihistaminic. The first generation antihistaminic will cross your blood-brain barrier. Okay, so it will produce sedation. Mind it, because it is able to produce blood-brain barrier, so it will produce sedation. So these drugs are not given in daytime, except one drug is there, chlorpheniramine. This is a first generation drug, but you can give this drug in daytime also, because it does not cause so much sedation as other drugs of this category cause. Clear? So they are less sedative, so can be given in daytime. Their drug is chlorpheniramine. Now second generation, they do not cross blood-brain barrier except your cetirizine. Clear? So as these drugs are not crossing blood-brain barrier, so there will be no sedation. Now second point, first generation antihistaminic drug have anticholinergic activity, antiemetic activity, anti-vertigo activity. For second generation, these activities are absent in second generation drug. Clear? Because of the anticholinergic, they can be given for the treatment of EPS. What is EPS? Extrapyramidal symptoms. Okay, when this extrapyramidal symptom, we will discuss in topic of antipsychotics. Okay, when we will discuss about antipsychotic drug, there we will discuss this EPS, that is extrapyramidal side effect. This is due to inhibition of B2 receptors. Clear? Now antiemetic for the treatment of motion, morning or sickness, then anti-vertigo for the treatment of vertigo. Third point, that they are anti-allergic, they are also anti-allergic, but these anti-allergic have both peripheral action and central action, but here only and only peripheral action is there. Okay, and because they are causing sedation, so these drugs are contraindicated in drivers, pilots and machinery operators. Clear? And these drugs are also not given in children, okay, and in old person whose age is more than 65 years. Clear? So these are the basic differences between the first generation antihistaminic and second generation antihistaminic, and you have to remember these basic differences, okay, between first generation and second generation drug. Now moving to the first generation antihistaminic drugs. Now coming to the next part, that is drugs. Okay, this is now come to the drugs. So first generation antihistaminics, I have discussed that they are highly sedative. Okay, but we also categorize first generation antihistaminic according to its sedation. So the first group which we are going to discuss is your highly sedative group. Okay, we have categorized the drugs into highly sedative, moderately sedative and least sedative. So the first group is your highly sedative. It includes 4 to 5 drugs. Okay, the first drug which we are going to discuss in that is your 1 minute. Yes. So the first important drug that we are going to discuss is promethazine. Okay, promethazine, then diphenhydramine, hydroxyzine, doxepin and doxylamine. These are the 5 highly sedative antihistaminic drugs. Clear? These are the 5 highly sedative antihistaminic drugs. That is promethazine, diphenhydramine, hydroxyzine, doxepin and doxylamine. Okay. Now coming to the promethazine. So promethazine has maximum sedation, okay, and it has maximum anticholinergic activity also, and it has maximum local anesthetic effect also, because it blocks sodium channel. Clear? So this promethazine has 3 important points: maximum sedation, maximum anticholinergic and maximum local anesthetic property. Along with this, promethazine also alpha-1 blocker, so it will cause hypotension as a side effect. Clear? Now coming to the diphenhydramine. And brand name of promethazine is phenargan. Clear? Now coming to diphenhydramine. So it is given as a posterior auricular patch, okay, for the treatment of motion sickness. Brand name is your Benadryl. Now hydroxyzine, it is longest acting and its active form is cetirizine. Doxepin is also a TCA, that is tricyclic antidepressant. We will discuss this in TCA. Okay, tricyclic antidepressant. Doxepin is also included in doxepin is H1 antagonist. Along with it is also included in TCA, and so it can be given for the treatment of insomnia. The most important, doxylamine. Okay, doxylamine is drug of choice for morning sickness, but it should be given with vitamin B6. Okay, so vitamin B6 plus doxylamine will be the drug of choice for morning sickness. Remember this. This is a very important point. Okay, that is doxylamine plus vitamin B6 is drug of choice for morning sickness. Now, this hydroxyzine can be antipyretic, and anxiolytic, okay, and antiemetic. These three activities are associated with hydroxygen. So these are the basic about these drugs. Clear? Okay. Let's move to the next. Now coming to the moderately selective. So what are the drugs which we have discussed in highly sedative? That is your promethazine. Okay. Then we have discussed diphenhydramine, then hydroxygen, then doxepin, doxylamine. Okay. Clear? Means we have discussed D3. Okay. pH. One more drug is there basically that we have left, that is this man D-methhydrinate. Okay. D-methhydrinate. This is also a drug. So the mnemonics will be your D4PH. Okay, they are the highly sedative. Now coming to moderately sedative, so the first drug is your cinarigine, then meclizine, cyclizine, okay, then phenidramine, then cyproheptadine. Clear? Cyproheptadine is very important because it is antihistaminic as well as anticholinergic as well as anti-serotonin. All these three activities are associated with cyproheptadine. So this drug is more important in compared to other for MCQ point of view. Okay, that drug is cyproheptadine. Both all the three activities are associated with cyproheptadine, antihistaminic as well as anticholinergic as well as anti-serotonin. Okay, so these meclizine and cyclizine are given for the treatment of motion sickness. Cinarigine block calcium channel on vestibular nerve. Clear? And this phenidramine, its brand name is Avil. You must have used that drug. Okay, okay. Now coming to the least sedative is 2 chlorphenidramine as we have discussed. Okay, we have discussed earlier, no? Chlorhistamine, then clemastine. Okay, and it can be given in daytime. Okay. Now two more drug also, triprolidine and dexchlorphenidramine. You can also remember these drugs. Clear? Now coming to the second generation. So second generation, they are anti-allergic drugs only. Okay, they are only and only anti-allergic. They have not anticholinergic activity or antiemetic or antivertigo activity. So they can be used for urticaria, rashes, and dry cough. Clear? Now, severe allergy, that is anaphylaxis, drug of choice will be adenine. Drug of choice will be not antihistaminic. Okay, adenine will be the drug of choice for severe allergy. For mild allergy, you can give this second generation antihistaminic. Now coming to the drugs, so first drug is estamizole and terfenadine. Okay, clear? These are metabolized by CYP3A4 enzyme. These drugs are metabolized by CYP3A4 enzyme. Okay, these all drugs are metabolized by CYP3A4. Now, erythromycin and ketoconazole, as we have discussed in our general pharma videos. Okay, these drugs are inhibitor, enzyme inhibitor, so it will inhibit CYP3A4. Okay, so it will cause its toxicity and by increasing QT interval. Okay, so it will lead to toxicity zip point. Hence, these drugs are banned. Okay, estamizole and terfenadine are banned due to increase in QT interval. Clear? The next drug is fexofenadine. It is active form of terfenadine. Okay, it also increases QT prolongation. Then the next is loratadine. Its active form is desloratadine, and this is the most potent of all these. Okay, loratadine. Then cetirizine. It is active form of hydroxygen, we have discussed, and is the most sedative second generation antihistaminic drug. Okay, in second generation, if you will ask which is the most sedative, then the answer will be cetirizine. Then levocetirizine. Okay, then misolastine, avastin, eclifastin. These are the drugs which are coming under the second generation antihistamine. Okay, okay. Now coming to the topical antibiotics. So it is used for the treatment of allergic rhinitis as a nasal drop or allergic conjunctivitis as eye drop. The first drug is A. You can remember like this: A. Loca. Okay. A for azelastine, levocabastine, olopatadine, ketotifen, and eliafatine. Okay. So remember this in our exam, in our spotter. Okay, in prof exam, this drug was asked: olopatadine. Okay, olopatadine was asked. This is where it is used and what is the basic mechanism of this drug. Okay, olopatadine. Remember this. And these two drugs, olopatadine and ketotifen, is also mast cell stabilizer. Clear? So these are the basic drugs, okay, which we have discussed in antihistaminic. In next topic, we will talk about, in next video, we will talk about anti-serotonin. Okay. So thank you for watching. Best of luck.